Hi everyone, we're going to be going over 5 exercises today to help relieve neck tightness or if you're having discomfort. So a couple of things that you're going to actually be needing, and these are some of my favorite tools that I've been using for several years now. Yoga tune-up therapy balls, and then also what's called a Coregeous ball. If you don't have one of these around, you can use a pillow or a rolled up towel. I actually don't have my yoga block, but I'm going to be using 2 of my favorite books, Atomic Habits, which I definitely recommend, and then Food, What the Heck Should I Eat by Mark Hyman. So we'll be using these more so as props, but again, just work with what you've got. But I definitely recommend getting yourself a pair of these guys. So the first thing we'll start off with is what's called the suboccipital release. And really this is an input to your nervous system. So even though we're going to be putting this in a particular area in the body, specifically where certain muscles can get tight, really the input that you're getting is going to be to help relieve tension in that area. And any kind of compression on the body is just going to bring a signal to the nervous system to just relax. And part of releasing tension is also calming your nervous system. So one of the things that I like to do, and I typically recommend doing this about 3 to 5 minutes right before you go to bed, but you'll place this right behind your neck. So you want to find what's called your suboccipital area. So if you're here right at the base of the skull, you'll find where there's a little kind of dip. So here's the center of our spine, and you'll feel tiny little bones through here, but we just want to stay more so right at the cranium, right at your skull. And you're going to place the balls just nestled in right on that suboccipital area, so the base of the neck. So we're going to place the balls here, and I'm going to have you lie down on your back. And again, you want the balls to be nestled in. How do you know if you're too high or too low? Well, you can check. So again, find your 2 fingers, place them right at the base of your skull, and place the balls right in that space. And the first thing I want you to do is just place your hands over your abdomen and simply breathe. So taking a deep breath, and then exhale, let go. And just kind of notice how this feels. Sometimes just even the weight of your own head can be sufficient amount of pressure to allow you to feel some of that discomfort if you're that tight. So you'll first start with just nodding your head up and down. So simply lift the chin a little bit and tuck the chin. Lift the chin and tuck the chin. And then you'll turn your head to the right and turn your head to the left. And as you do this, basically it's like kind of wrapping your thumb around the base of the skull, and you'll feel where you're feeling any kind of tension in that area. So if you find a spot that's particularly tender or uncomfortable, sometimes you'll even feel it almost radiating to like the back of the eye or in and around your skull. Push your head back a little bit and then stay on that spot, and you'll nod your head up and down as you do this. And then switch to the other side and nod your head up and down. And come back to the center. Say no more discomfort or pain in my neck. Yes to feeling good. Okay? So this is called the suboccipital release again. And just by the mere position that you're in and having something there, it actually does create a little bit of a distraction on the neck, meaning it's separating the bones and helps to relieve some of that tension. So while you're here, you can do some intentional breathing. And if you have your ball there, you can combo this exercise, this movement. Inhale, expand your abdomen, and then on the exhale, press your ribs down, tuck your tailbone, and squeeze your ball. And then do that again. Inhale, relax.
And then exhale, press the ribs down, tuck your pelvis, and squeeze your ball. So you'll do that for a few breaths. And usually in this position, again, about 3 to 5 minutes. You don't want to hang out here for like 10 to 15. It would be too much of a stimulus, and anything done with too much of a dosage can actually be counterproductive, okay? So that's your suboccipital release. And then just kind of check in and see how you feel, right? You can turn your head as a check-in. And how do you know how much range is normal range? So you should be able to touch your chin to your chest, like so. And again, if you're here, assuming you don't have a current injury, you haven't had any surgery in your neck, obviously if you've had anything like a cervical fusion or any kind of trauma to the neck, then this might be very different. So do not try to force this. And if that's the case, you can always reach out to us if you have any specific questions, or your physical therapy of choice, physical therapist. So again, what's normal? You're gonna bring your head down. That chin should touch the chest. And then turning your head, chin to collarbone, and then other side. You should be able also to extend your head back and also side bend. But typically, if you're able to get into this position of flexion, and then the combination of rotation and flexion also treats side bending, which is lateral flexion of your neck. All right, so the next thing we're gonna do here is you're gonna grab one therapy ball and you'll place it right on your upper trap, okay? So we're gonna go right along this area here. This area, typically if you have neck discomfort or tightness, or if you've woken up with a very stiff neck, tends to be an area that gets very, very stiff. So part of what you'll do is you'll place this right along the top of your shoulder. And here's my shoulder blade, right? You can see it right in there. And I'm just gonna go right above that. Just kind of nestle in through this area. And what you'll do here, you're gonna lean your weight into the right side. I'm gonna show you a progression. And again, if this is too much, you can always do the same movement at the wall, standing against a wall. So we'll lie down just like this. And let me actually remove my books. All right, so you're here. And you'll place the ball just nestled in by your shoulder. And then just first sit there and see what that feels like. You can just kind of move around a little bit, kind of a little side to side, or you can lift your hips up and then bring the hips down, and then try that again. Lift your hips up, lift the hips down. If that feels okay and doesn't bother you, then you can go ahead and add the arm. Bring one arm back, and then bring the arm down. And again, look to reposition if it feels too uncomfortable. Maybe up here it's too much tension if you keep the hips up and keep the arm overhead. So maybe over here I want to keep my hips further down, or just down all the way, and then bring my arm overhead, like so. Okay? So I'll show you what it looks like here. Again, I'm going to place the ball right in this area. Not on my neck, not on the actual spine, but just off to the side. And then I'm lifting up and over. Sometimes you'll hear a little bit of crunching or clicking. As long as you don't have pain while you're doing it, it's not too uncomfortable, and you can breathe through it, then it should be fine. Again, other side, you'll place this on your left side. And just lying on your back. Breathe. Just kind of get a feel for the pressure. And then you can move side to side, or you can go up and down, kind of shrug the shoulder, or lift the hips up, lift the hips down. A good rule of thumb, anytime anyone is working on you, and again, remember, part of what this is creating is a stimulus to your nervous system. It's letting your nervous system know to calm down, okay? And then we'll lift the hips up, bring the arm overhead, and then bring it down. And you can do about 5 to 10 of these. But again, don't overdo it. Good. And so let's say you have tightness in your shoulder when you do this and it's just too uncomfortable, then you wouldn't go as far. So maybe I just want to keep it right at about 90 degrees, lifting up and then coming down. So I've given you a few options there.
If you have any questions or comments, please feel free to leave them below, or feel free to direct message, instant message, or direct message us if you're on Instagram, okay? So let's move on. Part of that, again, the purpose of the breathing, the suboccipital release, and then the upper trap release is also to help you just calm down the nervous system. The next thing we're gonna do are a few exercises that I typically start patients with when there's any kind of neck tightness or discomfort. So the first thing is gonna be what's called a chin tuck and chin lift. So you'll see this exercise and you can do it in a sitting position, or you can do it in a lying down position. I'll show you seated and then we'll go on our backs. So here, what you're gonna do simply is try to hold yourself in an upright position, and then you'll bring your chin towards your throat, like so. So this is neutral, and then we're just gonna draw the chin in, kind of like you're gonna give yourself a double chin, okay? So you're here, and then pull in, and relax. So this is the motion. And we're gonna do this lying down, okay? But again, this is a nice way to test and see. If you have discomfort when you're doing this, this should not be uncomfortable. So you wanna make sure that you do talk to somebody about that if that's the case. So you're here and you can do about 10 of these, but let's go ahead and do it lying down. And you can also grab a band. I'll place the link so that you know where you can get these. But what I like about these is that we can use them for multiple different movements, and then they do have some tensile properties, and they're not too thin, so it doesn't cut into you. But we're gonna do that same movement, and we're gonna apply a distraction force to it, meaning, right, first we were just doing this chin tuck movement, but now if I wanna make it a little bit more challenging, I can add what's called distraction forces, meaning I'm trying to pull away at my vertebra, and in order for my neck not to go this way, all the muscles in this area have to work simultaneously in order to keep you in that position, okay? So you're here, and this is the movement that you're gonna do. You're gonna extend your arms, you're gonna be lying down when you do this, and simply lift your chin, tuck your chin. So we'll do this about 10 times, and then we're gonna progress that to a mini crunch, which basically is gonna be segmental cervical flexion, which is this motion coming straight down, and then spinal flexion, which is moving your spine and articulating each vertebra, trying to get movement in each of those smaller bones. All right, so we're here. You can keep the legs bent, or you can straighten your legs. And you're gonna lie on your back. Make sure you get your hair out of the way. And how much should you pull, right? Well, it depends. If this is your first time, maybe you want to go halfway. If you feel comfortable and you're able to fully extend your arms, you can do that. And you can place your hands in this position, just like this. And then I want you to squeeze the ball. And then as you do this, see if you can combine it with a breath. So we'll put it together. You'll tuck your chin and simply lift your chin and tuck your chin. Inhale, and then exhale. Inhale, and exhale. And you'll do about 5 to 10 of these. And once you've done your 10, you can either take a break or you'll move right into the next movement. So we just did cervical flexion, and now we're gonna add the rest of the spine. So it's almost like if you're doing a roll up. Inhale, and then inch your way up one vertebra at a time as you squeeze the ball, and then come down slowly
one vertebra at a time. And then again, inhale. Exhale, tuck your chin, tuck your tailbone, lift up, squeeze your ball, and then come down. And you'll do this again for about 10 repetitions. So let's try it. Tuck your chin and come up. Very good. And let's do one more. Good. So we've gone over your chin tuck, which is again the double chin, kind of doing that motion. And then you did chin tuck with cervical flexion and segmental movement of the spine, right? So we want to imagine that each vertebra is getting movement. And the reason you want to do that is sometimes, well, not sometimes, you do have muscles that actually span one or two vertebrae at a time. They're tiny little muscles called your multifidus. You have intertransversary. You also have muscles called your rotatories. If you want to really understand the anatomy and the spine itself, realize that it's not just one muscle. These muscles work simultaneously and are always typically on unless we have some kind of neurological dysfunction where we're not able to hold ourselves up, okay? And you'll see that typically more in patients that have spinal cord injuries or traumatic brain injuries or some other neurological deficits. But if you've had something like a herniated disc, or if you've had any kind of what's called neuropathy where the nerve is affected, then the timing in which those muscles fire will actually be inefficient. So this is what this is gonna help with. All right, so the next thing we're gonna do, we're going to this time lie on our stomach. So we did cervical flexion, right? And now the next movement is gonna be extension. So I'm gonna show you cervical extension, and then I'm gonna show you segmental spinal extension, which is basically the reverse of what we just did here. So instead of tucking our chin in, this time you're gonna start with your head down, and you're gonna simply bring your head down and bring your head up, okay? But you're gonna do this on your elbows. And then from that position, we'll keep the arms straight, and then we'll segmentally lift our heads and then start extending through the entire spine, okay? So I'll show you the movement first, and then I'll show you the movement with resistance. So in this position, you're gonna go ahead and place your hands just underneath your elbows right underneath your shoulder, right? So you wanna be in more of a not tabletop position, but in a sphinx posture. And you don't wanna just be kind of hanging out like this. You actually wanna push your shoulders away from your ear so you have some space there. And what you'll do here is you'll look down and you'll look straight up. You look down and straight up. Now, when you're coming up, I want you to add this pushing motion. Like you're almost like in a plank position, but you're not gonna lift your lower body. So as you come up, I want you to push your elbows into the ground. So it'll look like this. You'll inhale, and then exhale, come up, and then inhale down. And exhale, come up. So then next, you can add a bit of resistance to this. Okay. You'll look down and then come up. And you could do about 10 of these. Push your shoulders away from you. Good. And again, shoot for anywhere between 3 to 10 when you do this, okay? And then you'll give yourself a little break in between. You can turn your head to the side or the other side. And then while you're here, you can actually use this position to breathe. So now you have the ground at your stomach, so you can actually take a deep breath and push your belly towards the ground, and then exhale to release. And when you're ready to go, we'll move on to the next exercise. So from here, what you'll do, you'll keep your head down, and we're gonna start with cervical extension looking up, and then you're gonna come up one vertebra at a time. And as you come up, I want you to twist your arms so that you're rotating your arms out, and then we're gonna go back in. So this is internal rotation, right? Just like this. And then exhale, external rotation. And then coming back down. Look straight ahead and come up and then come down. And you can do about, again, anywhere between 5 to 10 of these. We'll do 2 more. If you want to add resistance to that movement, this is one way. You can grab your band and just place it in a figure 8 position, just like this. And then you'll lie down, keep your head down, and then come up, look straight ahead, and lift. Very good. Okay. So we went over your chin tuck. We went over segmental spinal flexion. Then we did cervical extension, and then we did segmental spinal flexion. Okay? Now the last exercise and movement you're going to do here is going to be specific to rotation. So remember when we first kind of checked in, you want to be able to turn your head to the right and tuck your chin down so that your chin touches your collarbone. And then you'll do that on the other side. You'll turn your head one way and then bring it down, trying to touch the chin to the collarbone. So that's the exact same movement we're gonna do next, except all I want you to think about is turning your head over your shoulder. Turning your head over your shoulder. And while we do that, we're gonna be again in that Sphinx position where your elbows are propped right underneath your shoulders, and you're gonna be pushing into the ground. So let me show you what that looks like. And at first you can start doing it just one way, and then you'll do it to the other side, and then you can alternate between sides. So I'll talk you through what to look for while you're doing this. So your elbows are propped up, just like this. And then you're gonna take a deep breath, inhale. And then on the exhale, you're gonna turn and look over towards your foot. And try to bring that chin towards your shoulder, okay? And then come back to the center. So while you do this, you're gonna also turn your hand and rotate as you push your elbow into the ground and back. So my elbow is pushing down and moving back this way, but I'm not moving the shoulder, so it's an isometric movement. Isometric meaning you engage the muscle, but you don't actually move through range of motion. So you're here, and I'm just gonna do 5 in a row so you can see what it looks like. Start with an inhale, and then exhale. And watch out for twisting of your hip, okay? Try to keep that hip down. Come back to the center. You'll do 2, 3, 4, and then 5, okay? And then you do the same thing on the other side. So let me swap. You're here. You're gonna go ahead and turn. Look over to your right foot. And remember, I'm pushing my elbow down and back, almost just depressing that shoulder blade, okay? All right. And then you can combo the 2 movements where you're here, you're pressing down, and you're looking over your left, and you're looking over your right. Looking over your left, looking over your right. And now when you do this again, make sure that you're not rotating your pelvis. You're keeping that hip down. And you may notice that one side may be a little tighter than the other. If that's the case, so you would do 10 on each side, but the side that's a little bit more restricted, you would do one more set of 10 on that side. All right, so that concludes our 5 movements to help improve neck tension or relieve actually, to improve the tightness that you're feeling in your neck. And if you're feeling any discomfort, please let us know. Shoot us a DM, give us a call. We'd be happy to help you individually. Have a good day. Take care.